Good evening, members, and welcome to our monthly webinar. This is our webinar on case presentations, and today we're going to go over one of those cases, and we're going to add into that some of the awareness characteristics that we showed you last week or 2 weeks ago when we did our video webinar. Just a few announcements before we get started, just to make sure we get everybody on the line. First, we have Dr. Sheldon's going to be going to Georgia on the 14th of April. It seems to be a pretty busy month for us in April, but he's going to spend a few days in Georgia to visit the residents, the para-residents for Georgia Regent University, as well as Fort Gordon. Also, we're going to be going to New Jersey for a day. One of our members there has gotten a group of periodontists together, and we are going to go speak with them or to them. We can also do that for any of our members. If you have a group or people that are not too far in an area, you guys can get together and we can come see you guys. So that's one thing we're doing on the 21st of April. So tonight we are working with patient Carl, and we're going to be working through why he came, what the plan was, and working through the awareness characteristics to get him to accept the plan that we've given him.
So Carl comes in referred by Ace Chat, and those of you who have been on for a while know about Ace Chat. If you take a look at our website, you'll be able to see how Ace Chat works. Good organization. It gives an opportunity for a patient to interact with your website with somebody who knows something about dentistry. Ace Chat is an independent group. They are out of Denver, I think, and we've had them for 5 years at least. Been very, very happy with them, and so take a look at how a chat service could help you. Okay, he states that his top front tooth has been broken for about a year. He had a root canal done, had a post, and he's been working until recently. He's interested in implant, and essentially what he was doing, this came loose a year ago. He had a post and core or a post and crown, and he would keep on putting it in, taking it out, putting it in, taking it out until the gum tissue grew over the root, and now he can't put it in and take it out anymore. You'll see what he looks like in a moment. So this was the phone intake that Sarah did. So she explains the $79 consultation fee and financing options. And yes, we did tell the patient that the implant can start here in the $2,000 range. And the patient had already had an implant, so he was familiar with implants. We had not done his previous implant. So I called. He did not return his call. Not everybody does.
Why?
You know, you figure they're so impressed. The doctor is calling them that they'd want, that they would just wait. They'd say, hold all calls. Open the phone lines because the doctor is calling. That didn't make sense.
Well, we don't really have that many, though.
You're right.
Most of them do.
All right, so he didn't. But we let him come in anyway.
That's right.
Okay. So he comes in with the intake with the dental assistant. The dental assistant finds out that
he wants to replace his missing front tooth. Now, we haven't showed you pictures yet, but when Carl comes in, he's not real shy about his situation. He's not putting his hand over his mouth or anything. He's proudly talking, and he's not covering it up, but he has number 8 is missing. And so he wants to find what his options would be to get a new tooth. He did have a post and a crown there. It did fracture off a year ago. For some time, he was able to put this in and out, but he says he's unable to do that. It doesn't stay in anymore, so he wants to get that fixed because the main reason is he wants to find a job. And he says the first thing people look at is his mouth, and as soon as they see he's missing a tooth, they treat him like he's homeless.
Okay. So medical history is non-contributory, 60 years old. Let's take a look first at Carl. So there he is in all his glory. And you see essentially a fairly good dentition. There's certainly a lot of wear that's occurred down here, and he knows that he's a Bruxer, by the way. So you see that. Retracted view, I don't think you're going to see much more, but I'll show it to you anyway. So there's the retracted view. You can see what you can see. I don't have to describe it to you. You are all dental professionals. You know what this is. So you can see what this is all about. And notice in this picture, which is a very, very important picture, and we're going to show you why. Notice in this picture the smile line and the position of the gingival tissue and the position of the papillae. All this becomes very, very important as you describe what's going on here. Now, so we look at this, and now let's take a look at the radiograph. Okay, so we see there's an apical on this tooth. We see that there's a nice root here. We also see there's some great palatal bone. Isn't that great? Good palatal bone right here. So the opportunity for an implant is great. We also see both in the PAs, and you'll see also in the where you see in the CT scan, we've got endo here, we've got endo and a post here. That looks like a lucency there. I can't prove it on the CT scan. Let me just show it to you. Certainly the tooth is suspect, and you could say that maybe that's it, and maybe it is. But there's no symptoms on this tooth. So right now, his only interest is replacing this one tooth. Okay, let's look at it from an anatomist standpoint, which, as you know, I think is great. So there we are with anatomage, and we can just show him what can be done here. So we'll go to the panoramic view. We'll put in an implant. Of course, we'll show this to him in the chair. Go back to this right here. Line up the implant appropriately. Show him that he's got a lot of bone. Enough bone that we could put a big long implant in here. Got plenty of bone here. And now, more importantly, he doesn't care about the implant. He cares about his tooth. So let's line up the axis a little bit better. And we're doing this for him right in front so that he can see this and see what this is all about. And now let's put a restoration on the tooth. So there's the crown, and we'll rotate the crown so that it looks good. Shorten the crown a little bit. Change the axis a little bit. And then we can widen it a little bit. And Carl, there's your crown. What do you think?
It covers the hole.
Yeah, it does. Covers the hole. That's all you're interested in. You're right, covers the hole. We can get that to look pretty good. So that's where we are. Now, let's go back to Carl. And Danielle is going to be Carl for a moment. And I will be me for a moment. By the way, let me just let you see the PAs before we do that. So we can take a look at the PAs all the way across. He did have an implant done here at one time. I don't even know how long ago the implant was done. We can see the endo with some kind of a post. Here, endo, no post. Or maybe a fiber post. It looks like there's a fiber post here. So that's where we are, and we'll go back to the photograph so you can see the photograph and just see where we are here. So there's a photograph. There's the retracted view. So let's go back to the photograph. And now I can say, all right, Carl, I see what's going on here. So so tell me what's going on from your perspective. Just give me an idea as to what's happened.
Well, this tooth fell out about a year ago, and at first I didn't think that, I don't smile that much anyway, so I didn't think it'd be much of a problem. So hasn't really bothered me, didn't really bother me too much, but now I am looking for a new job. I have been trying to look for a new job for some time now, and I can't do it because every time I go to talk to somebody, the first glance they make is at my mouth. They see I don't have a tooth, and they start treating me differently like I'm a homeless man, and I don't want that anymore. I know I can land these jobs, and this tooth, they keep looking at my mouth with no teeth.
All right, good. So what effect does that have on you personally if that occurs?
Well, I know this is the reason why I can't get a job. And I feel like I need this so I can talk to people, and they can look at my credentials, not my mouth.
All right, that's good. But you know, I've seen you. This is the first time I'm seeing you. You said this snapped off a year ago.
Yes.
All right, so why now? What's going on here?
Well, a year ago I was not too unhappy in my current job. I have since left that job, and I was thinking I could pick up a job pretty quickly, and it's not happening. So I think replacing this tooth now is going to help me get there much quicker.
All right, good. By the way, is this getting worse, or just tell me from your perspective what's going on here?
Well, it's getting worse because these are a lot of wasted interviews that I'm going through, and I would like to land one of these jobs.
All right, all right. So I guess we need to change this, huh?
We do need to change this. I do need to change this pretty quick. I'd like to know what, the fastest way is that I can get this tooth replaced. Money is a factor here. I have money that I have saved up. It's not like I don't have any, but I just want to make sure that I make the smartest decision.
All right, well, that's good. And there really is some hope for you, because if you take a look at this area right here, here's the root. You can see an abscess, which is a dark area. The dark area, that means there's an infection at the end of the root. So this root can't be used anymore for anything.
You can't just give me a new post and a crown I can put it up in there?
Yeah, it's actually a lot of reasons why we can't. Number one is the fact that you've got an abscess here. Now, I suppose the root canal could be redone. It could, and maybe that abscess would get better. But let me show you something else here. You see this area right here? That's called the papilla. You'll see there's a papilla here and a papilla here. Notice you've got a papilla here, and your papillae show. Imagine what this tooth would look like if this gum tissue wasn't here, if this papilla wasn't here. Be a big dark space right here, big black space, black space, black space. Now, let's assume that we could treat this tooth. What I would need to do would be to do enough surgery to expose the root, because the root needs to be sealed with the crown. If I did that kind of surgery, then I'd have to take away all of this gum tissue in order to be able to do that. Oh. Now, if you put in a crown here, you put in the crown, and you see this big black space right here. And you see a big black space here. This wouldn't look good.
Okay.
Okay.
I can see that.
All right. Good. So no. So we got to do. We need to do it in a different way. Now, there are two options we have. Number one, we could take the crown off of this and take the crown off of this and make this into a bridge. In other words, it would be supported by this tooth and this tooth.
Okay.
And that's a legitimate option. The difficulty I have with this is that this tooth is brittle. It's already had a root canal done. The root canal treated teeth are brittle. You already know that because this tooth broke off, right?
Okay.
And the same thing is happening here. This tooth is brittle. So now, if we're asking this tooth and this tooth to do the job of 3 teeth, how much more force do you think is going to occur on these 2 teeth? Okay. And besides that, when we take the crown off, I don't even know what the condition of the tooth is underneath here. Right now, I can see these teeth are doing well. And I also know that you're grinding the heck out of your teeth, and so we'd like to have as much support as we possibly can. So while a bridge could be done, an implant would be a better choice, because now we have the bone from this area where the root used to be. We can have the bone doing the work to withstand the stresses on this tooth, and that takes the stresses off of this one. Okay. And off of this one.
Okay.
Am I making sense?
Yep, that makes sense.
Good. So that's essentially where we are. So let's go back, and we're going to go back to the presentation. So let's remember the patients want 4 things, and I'm going to keep on doing it because because there are certain lessons we're just going to repeat, okay? When you're thinking about a patient, they want to smile, they want to chew, they don't want any pain, they don't want their mouths to stink. Those are 4 different reasons. So where do you think Carl is in this particular scenario? Of course, Carl is in the smile scenario. Chewing isn't really a big deal. You know, you can be missing a front tooth and can chew okay. But smiling, of course, is the thing that we're keying in on, and smiling is what he keyed in on, or Danielle playing him keyed in on, because he can't get a job. You know, he can't smile, he can't do anything with his mouth that shows, because he looks like a homeless person. Remember, we just went over the awareness characteristics. Okay, so what was Carl's ruin? Okay, can't get a job. Okay. What effect is that having on him? Well, the effect could be on his family. It could be on his own self-esteem. It could be any effect. Okay? Is this going to get worse, or is it going to get better? Now, Carl may look at it and say, hey, look, my ruin is I've got a broken tooth. Just fix it. Just go to help. I don't need to go through all these awareness characteristics. But in the case where a patient is trying to make up his mind to spend a lot of money, yes, then he is looking at this, well, do I really need to do it that way? Okay, so first, is it getting worse or is it getting better? Well, obviously it's getting worse. Okay, do we need to change this? Yes. And I do want to change it. And now we've given him all the reasons why there's hope. I showed him there was bone, and now help. Here is the way that we can help you. And that's what I pointed out by showing where the bone was, that he does have good bone, that in fact we can put a crown on that implant and make that implant look good again. So at this point, Carl has bought into the entire program. I'll show you the periodontal probing just to be complete. You'll see some mild periodontitis. He said he hadn't, just a little bit. And by the way, he keyed in on this 5mm pocket for some reason. So he knows a little bit about dentistry, but he also said, I haven't had my teeth cleaned in 3 years. Let's get my teeth cleaned, and I bet you they'll go away. And you know what? He's right. It will go away. So now Carl is going in the financial arrangements room. And now I'm going to be Carl, and Danielle is going to be the financial arranger. And let's go back to this photograph so that Carl can be looking at himself during this entire sequence. Also, Carl may be looking at photographs right behind his head that shows smile after smile after smile of every patient that we've restored. It's kind of neat when Danielle is doing a presentation, and right behind Danielle's head, that patient is looking at restored patient after restored patient after restored patient after restored patient, and it's usually me posing with him. Sometimes it's Matthew and me posing with him, and it's just this continual message that people come here to improve their smiles. Okay, so now I'm Carl.
All right, so Carl, what Dr. Sheldon was explaining was the best choice here for this missing tooth is to go on ahead and get the remaining part of that tooth taken out, do the bone graft and the tissue graft there, and place an implant. And like he said, the tissue graft is going to be to bulk up that tissue there, to make sure that when it comes time for crown placement to put that tooth there, that it's bulked up enough to support that crown and give you not only the best cosmetic look we can possibly give you, but also make it where it's easiest to clean around, healthiest, so you don't have any periodontal issues around that crown or any cleaning issues, irritations, none of that. So that's the best way to put in this implant. Once that implant goes in, you will wait about 3 months or so. Then once the implant has tested ready, we'll go on ahead and place the crown there, and then you'll have a replacement finally in that area.
Okay.
Any questions on that?
No, sounds good.
Perfect. So to do the implant in that area, the total amount for that will be $7,869.
$7,869. Well,
yes.
Well, I didn't pay nearly that amount for my implant. I just had an implant done a few years ago. It didn't cost nearly that much.
And I would guess that it wouldn't, because looking at your X-rays, I can, doing an implant in the molar area, you had enough surrounding bone to support that implant. You also didn't have the tissue situation that you do have in this area. To do an implant in the front is different than doing an implant in the back. So without the tissue grafting, we can't do this implant the correct way, the safest way, the healthiest way, the most cosmetic benefit way. And also without the bone graft, we can't do that. We are going to be doing the PRGF procedure that Dr. Sheldon had spoke about. That is the platelets. So we can use your rich platelets in that area to help with excelling the bone integration around the implant, to prevent any infections, to excel the healing, all those benefits with the PRGF. We are going to be using things like that Ostel unit we showed you. That's going to test the implant when we are believing it's time to go on ahead and load that implant with a crown, to make sure it is time to load that, because if you load it too early, that could result in a failure. Also, remember that with that cost, you're getting things that you wouldn't get anywhere else. And one thing is, you have a specialist doing this, and this is a periodontal specialist, so he's a specialist in bone and gum, so he's going to make sure it looks the best, it's the healthiest, and it's going to last you forever. The implant warranty, it's going to last you forever. So this is, you have to look at this as an investment. He talked about a bridge, and you can still do a bridge, and a bridge would be about $3,000 less. However, there's no guarantees on a bridge. That could last you 6 months, 6 years. You don't know. Even 6 years for you being 66, you're going to be going through this investment all over again. If you're going to lose those 2 teeth in addition, now you're looking at a larger bridge or more implants, or maybe not even those options anymore. So you don't want to think about that and jeopardize what you can do in the future. It's best to go on ahead and pay a little bit more and not have to worry about it in the future. You're done. It's all by itself.
What do you mean I'm done? You mean I don't have to come back to the dentist again?
Well, no, you're going to have to come back to the dentist. One, you did identify some of those pocketings because you haven't been going to the dentist, but we're going to keep an eye on you at least once a year. Dr. Sheldon may ask that you come back twice a year, maybe 3 times a year, but you're going to keep coming back. So 1, we can clean your teeth. 2, we can keep an eye on everything, and especially this implant, to make sure it stays healthy, which is why we can give you that implant warranty, because we're going to keep an eye on this.
Well, I'll tell you, I know that they didn't use anything to check for to see if the implant was in the bone okay, so last guy didn't do that. And nobody took blood from my arm, so I know they didn't do it that way. And all right, I've heard some good things about Dr. Sheldon, and I saw his website and I saw his Google reviews, so I guess he's the right one to do it.
Yes.
And I don't want to spend this money, but
nobody
okay.
does. I can tell you that. But this is the best choice for your investment, and I really want you to think about that. When I say you don't have to worry about this anymore, this tooth is done. If something does happen to this tooth during the implant in 6 months, 6 years, we take care of it. So you don't have to worry about that investment anymore. So it's a very important thing I want you to think about. Plus, you do have some options here on payments. You can do the Care Credit no interest financing for 12 months, and that'll bring your payments monthly to $655. If you don't want to do that, then you can also pay half now and half at the time of restorations, and that'll be about $39.35 each payment. So do some now, wait a few months, and then you can do it again. The other option that you have, which a lot of our patients usually do, is you've already said you have money saved up for this. I can give you a 5% discount. You can pay in full this week. It'll save you $394, which is a lot of money. It's a big chunk, and make it $74.75.
Okay.
Which one of those would you rather do?
No, I don't have a job right now, so I think I'm going to have to extend it out with some payments.
Okay, so we'll do the Care Credit of 12 months interest-free. They'll send you that information in about 30 days, but it'll bring your payments to $655. And then, when this tooth is restored in about 3 months or so, and you're out there and you can land that job you're looking for, you don't have to wait 12 months to pay it off. You can just go on ahead and pay it off. So, but since we're going to do the Care Credit, I can go ahead and run that now. We'll get it started now. And I'm going to go talk to Jennifer because I want to get you in as soon as possible and get this moving as soon as possible. And I think that we may have one opening for next week. And let me see if I can go on ahead and get you in that and get this rolling. How's that sound?
All right, good. That sounds good.
Great. All right, be right back.
So in a case like this, what we're going to do for him is we're going to make an Essex, an Essex appliance, which we'll make right here. We'll put in some composite into the area number 8 area, so it'll look half decent. We've told him that it may be better to make a flipper, and he says no, and he did say no to us. We would ordinarily do an Essex, allow the Essex to be there for at least 2 weeks, closer to 4 weeks, maybe even longer than that, to make sure that soft tissue forms, because we don't want to have a flipper, a temporary removal partial denture on that tissue. And the patient has the option of then paying for a flipper or paying for another Essex when it breaks, and we let the patient know in advance that each time you break an Essex, we can't guarantee them. We don't know how long they'll last, but it's going to cost $105 each time we have to replace an Essex. So he has the option of going to a flipper, which is more durable once the tissue is healed, or to stay with the Essex, and he's made that choice himself. So, and by the way, in a case like this, there are times when we'll extract the tooth, put the implant in, and put a temporary crown all at one time. The way he's a Bruxer, I had a lot of doubts about that. Originally, he and I talked about that. I'd certainly have to make number 8 shorter than number 9 in order to do that, because I don't want the lower incisors touching that temporary crown at all, and given the forces he places, there's a lot of trepidation there. So anyway, he agreed to the Essex, which was great, and that way I can sleep at night and not have to worry about his traumatizing that and traumatizing the bone and having to start all over with a brand new bone graft and waiting another 12 to 18 months before he had a tooth there. Ask me how I know. So that's essentially how this works and how we use the awareness characteristics. In our last session, which was 2 weeks ago, and which you will receive a copy of if you haven't received a copy of this already, because most of you, I think, are probably looking at this, looking at the CD now. Look at those awareness characteristics. This is a fundamental tool that we use in the office. It is something that will just work very well. And what we do at staff meetings, and we just did a staff meeting on this.
Yeah.
Actually, we did the same thing that you're doing on this one, because
we use our own videos.
Yeah. So thank you very much. So we use our own videos, and we did show the video, and next week, for about a half an hour, we're going to be drilling this, and that means that the staff members team up 2 by 2. Okay, one plays the patient, one plays the financial arrangements assistant or the doctor or whatever it is, and they make up a scenario and they carry each other through awareness characteristics, where the one who's trying to bring that person up is the student, and the person who is playing the patient is the coach, and is coaching the person to get that person up all the way, letting that student know that, yeah, you really got to my ruin, or no, you really didn't find my ruin. Keep on asking more questions until you get there, and then just bring them right up from ruin all the way up to help. This team effort works really well, and once they've gotten through it that way, then they reverse roles and do it again. So this requires a lot of drilling. This is not something that
It does.
You get by osmosis. You don't. But once you get it well ingrained, and you're thinking about it, and you have these awareness characteristics available to you, it can make a big difference in how you communicate, and frankly, how the patient communicates with you. Because now the patient is not looking at you as a mechanic who collects money. The patient now is invested in you emotionally.
Right. Yep.
So, anything else you want to talk about tonight?
Nope, that's all I have.
All right, good. That's it for tonight's webinar. Thanks for joining us. We'll see you and talk with you again next month. Bye-bye.